Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine chiropractor. I just thought of doing this video to go over some of the terminology and some of the understanding of the different rights in things that you need to be aware of because you were in a car accident. So stay tuned. Thanks for watching, and let's get down to some of the terminology that are foreign to you, but they're pretty commonly used with regards to car accidents. So first of all, I want to make sure that you understand, obviously, I'm not an attorney, I'm not an insurance adjuster or anything like that, but these are the things that we explain to patients, and these are what you have to probably understand. You can obviously talk to your insurance representative to better understand what's going on with your policy. But generally speaking, you've got two choices. Either you're in a car accident and you're at fault, or the other person is at fault. So let's talk about when you are at fault. When you're at fault, you've got two choices. You either have MedPay, which is the medical portion component of your auto insurance that will pay for injuries for you or anyone in your car, or you don't. If you don't, then you have to use your health insurance for injuries that you sustained because of your recent car accident. If you do, then you obviously use your MedPay. If you don't have health insurance, then that's out of pocket for you. Now, if you're at fault and you choose not to do anything about your situation or your passengers, well, that's a whole different ball game. Now, we're not going to go on and see if the passenger has any a MedPay on their car or not. That's beyond this video. But the other person that you hit can file a claim against your auto insurance. Your premium will go up. So if you're at fault and you use your MedPay, your premium will go up. Why? Because your own auto insurance paid something for the injuries for you and your passengers. So that's that. Now, if you're not at fault, you have MedPay, then the medical portion of your insurance, auto insurance called MedPay, will pay for your expenses related to injuries, and they will not raise your premium because they're going to go around and collect from the other guy's insurance plan. So your MedPay you're using, you're not at fault, your premium's not going to go up. Now, why is it that sometimes your own insurance adjuster says don't use MedPay? Well, that's because they don't want to pay out of pocket. They don't want to pay for anything and not collect from anyone. That's understandable, that's business, but that's not why you have MedPay. So a lot of times you get I would say an unfair advice. So that's not cool. You're paying into something to use it and your own adjuster says don't use it. So you gotta kind of, that's a decision you have to make. Now, if you don't have MedPay, now you have two choices. Either you get an attorney, at which point you sign a lien. You and your attorney sign a lien saying, hey, doctor, we'll pay you once the claim is settled. That does not mean if the settlement is less than what your medical bill is, you're not going to pay. You are always responsible for that. Now, your attorney may want to negotiate and all that jazz. That's something the attorney does. That's something the doctor's office does. I personally am not a big fan of giving discount. Obviously, I do the work, I charge for it, and I expect to get paid. So that's a whole different whole different video, I guess. So if you don't have an attorney, which you don't have to have, you can do what's called pro per lien. That's a contract between you and your doctor's office. So that again does not mean that you do not have to pay your bill. So if you settle less than your bill, well, guess what? You're going to have to pay out of pocket. Now, if you settle less than your bill and you have health insurance that the doctor accepts, then that can be used. And if there is anything left, then it's out of pocket for you. Now, sometimes you're not at fault, but the person, it's a hit and run. So the person hits your car and disappears. On your insurance plan, you have a coverage called uninsured motorist. That's for people who basically hit and run situation. So you may not be at fault, the other person is not available or does not have insurance, then you use your uninsured motorist and they do not raise your premium. So I know it may be a little bit complicated, but it really is not. Bottom line is obviously drive safe and be careful. If you get in a car accident, if you have MedPay, use it. Let the insurance companies discuss and try to get paid from each other. And if you don't have it, then you can follow the path I gave you. Once again, I'm not an attorney. I'm not going to give you advice. So don't come to me and say, well, Dr. Shakib said this. So look into this. I have health insurance and I do have MedPay and I live very close to my office. So the reason for that is because I know when I'm in a car accident, it really impacts you regardless of damage to your car. It is very taxing on the body. It's very exhausting on the body. And of course, there is no x-ray or MRI that shows the extent of your soft tissue injury necessarily, because most of them fall below the radar for x-ray or MRI, but that does not mean you're making this up. So I rather have insurance companies take care of the bill and I don't have to worry about it. So if you have MedPay, use your MedPay and let your insurance company go after the other guy's insurance company to collect for what they paid out. Hope that this helped. Thank you for watching. Now, this is a video that has nothing to do necessarily with different health conditions and all the other videos I have on my YouTube channel, but we seem to be getting a lot of these simple questions, and I thought to do a video on that. Take care and don't forget to subscribe. You take care.